Many patients with lupus report stressful situations before a flare of their disease. But is there any evidence to show that stress may actually cause lupus? Could stressful events in your childhood or recent traumatic events be putting you at risk for lupus? Scientists are still not sure what the exact cause of autoimmune diseases like lupus is. Autoimmune diseases occur when our own immune systems attack the tissues of our body. In the case of lupus, we suspect genetic causes or exposure to ultraviolet light or infections. But are we missing something? Lupus patients around the world are telling us that prior to the onset of their flares of their disease, they had experienced traumatic, stressful events. But could traumatic stress also be the cause of lupus? Stress results from anything that threatens the integrity or the existence of our being. Stress could be psychological or it could be physical. And over the thousands of years of human evolution, we have developed an efficient mechanism for dealing with stress. This mechanism, known as the fight or flight response, protects us from the harm or danger of the perceived threat. So why then should stress matter in lupus? When we perceive a threat that causes stress, the neuroendocrine fight or flight response kicks into action. The sympathetic nervous system causes the nerve endings and the adrenal gland to produce norepinephrine and epinephrine, two hormones that increase the blood pressure, increase the heart rate, and increase our rates of breathing. Norepinephrine also stimulates monocytes, immune system cells found in the bone marrow, and causes them to produce inflammatory cytokines, which are released into the blood flow. At this point, we are ready to face the threat. At the same time, a portion of the brain known as the hypothalamus secretes a hormone known as corticotropin-releasing factor. This stimulates the pituitary gland to produce ACTH, or adrenocorticotropic hormone. Adrenocorticotropic hormone then stimulates the adrenal gland to produce cortisol. Cortisol is a hormone that modulates the immune response by causing the production of anti-inflammatory cytokines that counter the inflammatory cytokines produced by the sympathetic nervous system. Once the threat has resolved, the immune system reverts to the original state. In some cases, however, the threat is persistent or it is so intense that this system is disrupted. The level of cortisol and the accompanying anti-inflammatory cytokines fall or burn out, and the inflammatory branch of this system remains unchallenged. We are then in a state of persistent and perpetual activation of the immune system, which can cause the immune system to attack the body's tissues and lead to autoimmune diseases such as lupus. In people with PTSD, post-traumatic stress disorder, this is manifested as a persistent elevation in the levels of inflammatory molecules in their blood, such as CRP or C-reactive protein, interleukin 6, or tumor necrosis factor alpha. Studies done on children who had either been abused or maltreated in their childhood showed that they had increased levels of inflammatory molecules in their blood and that they had an increased risk of developing autoimmune diseases 20 years into their adulthood. Other studies done on veterans with PTSD from the Iraq and Afghan wars showed that they too had an increased risk of developing autoimmune diseases. A Swedish study done on women with PTSD or who had suffered other traumatic stressful events showed that women with PTSD had a threefold increased risk, and the women with other traumatic stressful events had a twofold increased risk of developing lupus. We all need to take time out from time to time to unwind and to maintain a stress-free state of mind. The harm done by stress goes far beyond our psychological health and even threatens our very existence. Thank you for watching. I hope you found this video useful. If you did, like and share the video with friends and family. Subscribe to the channel to support the channel. And I'd like to thank those of you who already have subscribed. Until the next video, goodbye.